listening to the myPET podcast, the show for pet lovers of Australia and around the world.
Hi, you're listening to the myPET podcast. I'm Aria and I'm here as always with our resident vet, Dr Glenn.
Hello.
How are you doing?
I am awesome.
That is so good. I knew you were awesome, but how are you?
Well.
So we're going to talk about rat or mouse bait poisoning today, but this is just general advice. So for advice specific to you and your pet, have a chat to your pet's treating vet.
Particularly with rat bait.
Particularly with this, yes.
Yep.
So straight up, there's no such thing as safe rat bait or mouse bait. Is that right?
Correct, because it's aimed at killing stuff.
Yeah.
And it is very effective at killing rats and mice, but it's also very effective, unfortunately, at killing our pets, mostly dogs, cats occasionally, and lots of wildlife, unfortunately.
Yes,
Yep.
I know. It's terrible. So how do the baits work? How do they kill stuff?
I mean, essentially, all the ones that the general public's going to be using, other than farmers killing mouse plagues, is a rodenticide that it's an anticoagulant, so it causes bleeding. Rats and mice bleed to death, essentially, internally, externally.
So anticoagulant
Yep.
means that it stops the blood from
clotting.
clotting.
Yeah.
So that
Yeah.
causes a whole heap of problems.
Yes. So there's first generation and second generation, third generation. Like, we've got better at killing stuff.
Okay.
So it takes less of the meal for the rodents to die, which also means that if a pet eats the bait, it dies more effectively and lasts longer in the system, which is important as far as the treatment and antidotes, how long you've got to use it for.
Yeah.
Yep.
There are some that are marketed to be more safe.
Yep.
What's the story with those?
I mean, they're more safe because it kills the rats effectively, but it maybe breaks down in the environment faster. They're marketed as safe, but they're still not really safe.
Yeah.
Is the realistic thing. I
Yeah.
mean, it certainly bioaccumulates in dogs. Theoretically, if a dog eats a rat that's been poisoned by rat bait, there's still rat bait potentially certainly in the gut of the rat or mouse, and in the body of the rat or mouse. So theoretically, I mean, they could get toxicity from eating the bodies of things that have eaten the bait, both by ingesting the actual animal, but also the gut contents as well. Poop, I'm not really sure how much comes through because it's probably pretty effectively absorbed. It's got dyes in it as a rule. Most of them have got a blue or a green or a red dye that goes with it, and you see rat and mouse poop that's had baits that's coloured. But I suspect that's mostly the dye just coming through undigested without actually there being much poison in the poop. It's the animal that's got it in it. But definitely wildlife, if they catch rats and mice that have got it, it does bioaccumulate, and it's a problem for raptors and owls and that sort of thing. It certainly kills them over time, unfortunately.
I know, it's horrible, poor things. And nightjars, tawny frog mouths. And those beautiful, beautiful creatures. So what happens if a dog eats or a cat or any animal eats either bait or a mouse or rat that has been killed by bait?
Look, I mean, the baits are the most common thing that vets see, where the dogs mostly, because cats don't really like eating the baits as a rule, and I see very, very few cats with toxicity, but I see lots of dogs, and I see mostly dogs that have knowingly eaten it, or pet parents suspect they've eaten it, or sometimes occasionally you'll see them clinically with blood clotting disorders and bleeding. It causes blood clotting disorders, so it can be quite variable what the actual symptoms are. Obviously bleeding, so bloody poop, bloody vomit, bleeding from the mouth, the gums, any orifice basically.
And if any of those things are happening, it's like straight to the vet.
Correct. Yeah. Regardless of the cause, if you see that, okay, you should be going to the vet.
Yeah.
The internal bleeding is more of a problem. So coughing sometimes. If you've got bleeding into the lungs, you're going to get coughing. Bleeding into the abdomen. I mean, it might be just pain. Could be sudden collapse. Could be acute death. If you get bleeding around the heart sac, around the pericardium, bleeding in the brain. Yeah, there's lots of badness basically.
Yeah, and I guess it's important to be aware of these signs because even if you're not baiting, your neighbour could be.
Yep.
So, it's always something to kind of be aware of.
Yep. and just going places. I mean, and most of a lot of toxicities I see, like they happen in the house most commonly, and it's your bait and it's your pet that ingests it. But I see quite a few that went to mum's place or dad's place or a friend's place, and they took the dog along for a visit, and the person who put the baits there weren't expecting a dog to have access in the back of the cupboard or in the garage or wherever they go. And I see that quite a lot where dogs visiting a place and they get the rat bait that has been there for a couple of months, and there wasn't a dog at that place, and it causes troubles.
So what is the treatment options for this kind of poisoning?
I mean, if you see them ingest it, or suspect that they've ingested it. I mean, certainly, within a couple of hours of ingestion, off to your vet, induce vomiting, which your vet can do very effectively. There's multiple like home remedies, soaps and salts and all sorts of stuff, which are not very effective at home. I would strongly recommend going to your vet to get them to induce vomiting. And
it's just, you just don't want to deal with it.
No. Because, you should go to the vet anyway.
Yes.
So if it's within a couple of hours, induce vomiting, get as much out as you can. You can give them activated charcoal orally to absorb after they've stopped vomiting, to absorb as much of the toxin as possible. And then there's a conversation with the vet. Do we just start them on the antidote, which is vitamin K1 basically? So it's quite a innocuous medication that you can give in injectable form and then orally for a time to counteract the effect of the anticoagulant, because it just takes away one of the clotting factors, and you give the extra vitamin K1 and their blood clots normally, and everything goes well 99% of the time. And the medication is very safe. Nothing's without potential side effects, but in general it's a very safe antidote. Do you start that straight off, or do you do a blood test in a couple of days' time, usually day 3, if you know the time that they ingested it? If the rat bait disappeared sometime in the last week or 10 days, okay, you probably do a blood test now and do another blood test in 3 days' time. It usually takes a couple to several days to cause enough of a problem in a dog to cause bleeding trouble. So it's not 5 minutes after they ingest it, which gives you some time, which is good, but it also means that, okay, they digested it a couple of days ago, they could be in trouble now. So the test is just, there's a couple of different clotting tests that your vet can do, and that diagnose have they got a clotting problem or not. And if they have, it's onto the antidote, make sure there's no sign of bleeding problems already, and then depending on what the bait is. So if you use the bait, set the bait out, take the box along to the vet so they can see what it is, and that will dictate to some extent the time frame they need to be on the antidote for. And it's all dose related. So usually your vet will put them on the antidote for 10, 14 days, take them off the antidote and test them 3 days later. What's their blood clotting factors then? And usually they're fine. I've had patients like 6 to 8 weeks. They've still got abnormal clotting time. So you put them on for a fortnight, do the test, still abnormal, on the medication for another 2 weeks, and it's just tablets. It's just oral. And you test them again. Okay, are you clotting normally or not? And if you are, awesome, that's the end of it. But you just got to wait for the body to get it out of the system, and there's a half-life there. So if they absorb a bucket load, they're going to be on the antidote for longer. But the only way you know is to take them off for a bit and then test, okay, are you clotting normally or not? Simple tests.
So if people have to use baits, because there are, traps and other methods which you can use. But if people need to use baits, what are some tips to do it a little bit more safely?
Always bait stations. So, an enclosed hard shell plastic containment unit for the baits, and usually that's like your wax block style baits where they've got little wires in the bait station that the pet can't get into. And when I say can't get into, I mean if a large dog has access to a bait station and they have got enough time to do it, they can chew their way into it. But if you preferably secure a bait station where a dog can't get it, the baits are secured within the bait station so the rodents can't remove the bait and take it somewhere else, because that's the problem with the little sachets. Baits can be, rodents can move them to somewhere else. The pellets, again, what's the access point? And I mean, if it's up on the shelf, okay, does something knock it over and then they fall on the ground? It's just limiting access at all costs. And in my opinion, the bait stations are the best way to do that.
Yeah.
If you need to use them.
Yeah. But it is. They are. Wildlife don't get to go to the vet for vitamin K and tests and stuff. So
it's complicated. I mean, I've got a farm. We had lots of rodent problems, and I baited for years. I stopped baiting 5 or 6 years ago, and use some live traps, and then use vehicle carbon monoxide poisoning on the rats.
Wow.
To kill them. That's how I do it at home. Which is because if you trap them, okay, you've got to either euthanize them somehow or relocate them somewhere away from your home. I mean, that's your two choices basically. So that's the way I do it. But it's complicated.
It is,
I'm
in the same boat.
Yeah, better to try and limit the food sources for rodents so
Yes.
there's less around. Keep all foods as contained as possible so there's no food sources for the rodents, so there's less likely to have them around.
Yeah, that's right, yeah. Well, thank you so much for sharing your knowledge with us about this, and at least it is a pretty simple road to a healthy dog if this does happen. But can be pretty nasty.
Absolutely.
Yeah. So, thanks so much, and thanks for watching, guys.
Take care out there.
Thanks. Bye.